I have a medical story to share with you that may be similar to others, but may have more parts than other people's stories. The 18th year following my first breast cancer diagnosis, an MRI led to finding something in the other breast, the one that had not been suspected. In the course of laying out the plan for that, it was time for my annual physical exam. So I went in for that, unsuspecting that there was any problem, only to find out after much testing that I had very serious cardiovascular disease and had immediate bypass surgery first thing next morning.
She was in this bed with rollers. She looked so small, and they wheeled her off. And I thought, well, I may never see her again. I'm sorry.
For years, I had been on the proper medications. I had eaten the way I was supposed to eat. I was exercising. In fact, after my husband and I got settled in Mount Pleasant, we started working with a personal trainer. And I still remember the nurses kind of chuckling as I was walking around the halls the day after surgery while other patients were still in their beds not wanting to put their feet on the floor. But I was determined that I would be well. There are so many doctors to thank, and I know they say, oh, well, that's not necessary. But in my case, it is, because this was my family. That includes Dr. Amraju, my primary care physician who spotted the first problem with the heart, and Dr. Baker, who was willing to dig a little deeper to see if there really was an issue with breast cancer, which of course there was, and now there isn't, and Dr. Saccone, and all the many others, and every member of their staff, and every person who works for the Roper St. Francis system. I say thank you, because your caring comes through, and it helps.
To a great degree, in many, many places, many organizations, philanthropy is that margin of excellence, moving from here to here.
Your family may not need Roper St. Francis today. We didn't know we needed them, but in the blink of an eye, we needed them badly. And they were there for us. In order to keep them there, the resources are necessary, as John has said, to provide that margin of excellence so that you can always depend on it, even when you're not thinking about it.
The quality of our staff is so high that it just makes it a whole lot easier to practice medicine. Part of the reason that we have this system is because of the philanthropy. I think our work is your work, and what we're able to do is in large part responsible. It's you who give us the means, or help to give us the means to do the work that we do.